Part 15. Diagnosis and treatment of ENT disorders. Myopia.
近视。近视，古称能近怯远症。
Myopia is the failure of the eye to see clearly, especially distant objects.
看远物，模糊不清。
The disease is caused by the elongation of the eyeball, which results in erroneous refraction, so that parallel rays are focused in front of the
调
retina.
节静止状态下，平行光线经眼球屈光后，所成焦点在视网膜之前。
Myopia commonly occurs in adolescence.
病因
Myopia occurs with people who have unhealthy habits in using the
是
eyes.
用眼
For
习惯不
example,
良、
being
看
too
书
close
写
to the
字
objects
不
when
看
reading
近
or writing, or
坐
bad
姿不
reading
正
posture, or inadequate
光
or
线
excessive
不足
lighting.
或者太强。
Congenial deficiency also partly
部
contributes to the
分因
problem.
先天禀赋不足造成。
Treatment.
治疗
First of all, correct the
首
unhealthy
先纠
habits.
正不良习惯，
Read and write with a proper
看书写
posture.
字姿势要端
Keep a
正，
distance of 30 centimeters between the eyes and the book.
眼睛距离书本
Reading in a lying position.
不要躺着看书，
Avoid reading during walking or while on the bus.
走路乘车也不要看书。 注意光线适中，
Proper lighting of moderate
不宜过
brightness is
强或
recommended.
太弱。
Avoid reading for excessive periods of time.
看书时间不宜过久，每次阅读1小时后稍作
Take
休息。
hourly breaks during reading and look away to relax the eyes.
眺望远方，使眼睛调节放松。
Body acupuncture.
针
Locate Jingming, bladder 1,
穴
and Chengqi, stomach 1. Puncture 0.3 to 0.5 twin perpendicularly to promote the qi blood circulation
以疏
of the
通
local
局部
meridian.
经络气血。
Locate Yiming, extra point, and Fengshi, gallbladder
风
20.
池穴
Puncture 0.5 to 1 twin obliquely to regulate the meridian in the
截刺
eyes.
5分至1寸，以调经明目。
Combine Hehu, large intestine 4, and Zusanli, stomach 36, of the Yangming meridian to strengthen the spleen and nourish qi. A reinforcing technique is applied to the
各
points
穴
mentioned
均用
above.
补法，
Retain the needles for 20 to 30 minutes.
每次留针20至30分钟。
Plum blossom
梅
needles.
花针
Slightly tap the points around the
轻口
orbit
沿
and the
黄
neck
周围穴
region,
位，
Huatou, and Jiaji, extra points, of along the
及
spine
颈
for
部
3 to 5 minutes. It has the effect of
华佗
regulating
夹
qi
脊
and
穴
blood in the
3至
eye
5
region
分钟，
and the functions
可
of
通
the
调
zonal
眼部气
organs.
血和脏腑功能。
Treat 1 to 2
每
times
天1至2
daily.
次。
Auricular acupuncture. Locate the sensitive
取
spots
眼
in
区
the
敏
eye
感
region.
点，
Liver,
肾、
kidney,
目一、
eye 1, and eye 2.
埋耳珠、
Auricular point pressure therapy is used by embedding seeds.
有耳
Press
压
the
法，
seeds 2 to 3 times daily.
每天按压耳珠2至3次。
fit
保
massage.
健按摩，
This can be done by doctors
可
or by
由
the
医
patient
师按摩
himself.
病人，也可病人自我按摩。
The manipulation of pressing,
点
digital pressing,
拿3
and
种手法
grasping can be used.
办法是从
Pressing is
睛明穴
applied
开
on the
始，
area from
由胖动
Jing,
眼
bladder
按
1,
至丝竹
along
空
the
穴，
supraorbital margin to Sijukong, Sanjiao 23, and Taiyang extra point.
由
Then
眶下
along the
眼按至
infraorbital
童
margin
子髎
to
穴
Tongziliao,
次，
gallbladder 1. Press a total of 6 times.
点
Digital
法是用
pressing.
拇指尖峰
Chuanzhu,
依次
bladder
点指攒
2,
竹，
Sijukong, Sanjiao 23, Taiyang extra point, Tongziliao, gallbladder 1, Sibai, stomach 2, and Fanshi, gallbladder 20, are digitally pressed by the thumb one at a time. Press 1 minute for each point. Grasping is done with the thumb, index, and middle fingers of the right hand
拿
to
法
lift and
是用
squeeze
右手
Taiyang,
食
extra
中
point,
3指提捏太阳，
and
风池
Fanshi,
反穴
gallbladder
每
20.
穴6次。
Treat each point 6 times.
针灸对假
The
性
treatment
近
is
视效
more
果较好
effective for pseudomyopia. One with genuine myopia should wear
真性近
glasses
视
for a period of time to
则
correct
需
the
及
vision.
时佩戴眼镜以矫正视力。无论
Whether it
真
is
性或
genuine
假
or
性近视，每
pseudomyopia,
天早晚
one
看
should
镜
look at
子
distant
和
or
远
nearby
处
green
绿色
plants
植物
every
可
morning or
以保
evening
护
to
视力。
protect the vision. Conjunctive congestion with swelling and pain.
目赤肿
Its
痛
acute
是眼科
symptoms
疾
are
病
of
的一个
ophthalmic
急性症头，
diseases pertaining to
属中
wind
离
heat
风热
and
炎，
TCM, which
见
is
于
commonly
急性
seen in
假膜
acute
性结膜炎、
pseudomembranous
流行性角
conjunctivitis,
膜炎、结
epidemic
膜炎。
keratitis, and conjunctivitis. The main symptoms are red and
主要
swollen
症状
eyes,
是眼睛红肿、
the feeling of foreign objects in the
有
eyes,
异物感
and
或烧
burning
灼感、
sensation, photophobia and pain, lacrimation, and secretion
晨
coherence
起
in the
双
eyes
眼
and
肠胃
living.
分泌物沾肿、
Pathogenic factors.
病因
Wind and heat are
为
caused
外
by
感风
external
热
pathogenic
或肝
factors,
胆火
or by the
邪、神
flaring
经
up
上
of the
扰所
fire
致
of。the liver and the gallbladder along the meridian. Treatment.
治疗
Body
针
acupuncture. Select
取眼
Jinming
部穴
bladder
位睛明
1,
穴，
puncture
指刺
0.3 to
3至
0.5 twin perpendicularly.
取
Select
太阳穴
Taiyang
点
extra
刺出
point
血
for
以
bloodletting
泻
to
热消
dispel
热。
heat and relieve swelling. Select Hagu, large intestine 4,
取手阳
and
明大肠经的
Shichi,
原
large
穴
intestine
和
11 of the
和
hand
穴
Yangming
虚
meridian
实
respectively.
直刺5
Puncture
分至1
0.5 to 1
寸，
twin
能解表
perpendicularly to
情
expel exogenous pathogenic factors and clear the heat.
配风池穴
Puncture,
斜
gallbladder
刺
20 is
1至
punctured 1 to
1.5寸，可以
1.5
疏
twin
风解
obliquely
表。
to disperse wind and expel
各
exogenous
穴
pathogenic
均用
factors.
泻法，
The
每天
reducing
1至
technique
2
is
次。
used once or twice a day.
刺络
Manipulation of micropuncture. The depletion method. Use a small 3-edged needle,
是用
prick the
小
vein
号
at the
3棱针
posterior ear
针
to
刺
deplete
耳
a
背
small
静脉
amount
出
of
血，
blood.
或针刺耳尖
An
出血。
extra point as an alternative. Then slightly wipe the blood with an alcohol cotton ball. Press the punctured part
再用
while
酒
wiping
精
the
棉
blood
球轻
repeatedly until the bleeding stops.
边取血
Treatment is
边
given
补
once
血
a day.
反复几次，直至停止出血为止，每天1次。
Tinnitus and deafness. Both tinnitus and deafness are auditory disturbances. Tinnitus is characterized by sound in the ears, which interfere with hearing, while deafness is the failure or loss of the hearing function.
耳聋则是病者听力减退或者听力完全丧失。本病见于
They may
流
be
行性感
complicated
冒、
with influenza,
中耳炎、
otitis media,
外耳道炎、
otitis externa, tympanic membrane perforation or disruption, hypertension,
内
auditory
耳性眩
vertigo,
晕、
and intracranial tumors. Differentiation of symptoms and signs. Clinically, it is divided into two
临
types,
床分为
excess
实
and
症
deficiency.
与虚症两类。
Excess syndromes includes two types:
实症
wind heat
有外
caused by
感风
external
热和
pathogenic
肝胆
factors
火盛
or
两
by
类。
excessive fire of the liver and the gallbladder.
外感风热
Wind heat caused by external pathogenic factors is characterized by a sudden
病
onset
的
of
突发耳
tinnitus,
鸣，
deafness, accompanied by fever,
伴有发热、
aversion to
风、
wind,
头
headache
痛等症、
a red tongue with a yellowish coating,
脉滑
and a
数。
rapid and rolling pulse.
肝胆
Excessive
火
fire
盛
in the liver and gallbladder is characterized by tinnitus and deafness,
耳鸣耳
aggravated
聋
by
会
depression
因
and
运动
anger,
而加重，
a dry throat
伴
and
有
a bitter
头
taste in the
偏
mouth,
干、
vexation and
心烦
susceptibility
易怒
to anger, a red tongue with a yellowish coating, and a rapid and wiry pulse.
虚症
Deficiency
常
syndrome
因
is
肾阴
often
黑素
caused
阻
by a
绝，
deficiency in the kidney yin.
发病慢，时
It
轻
is
时重，
characterized by
反复不
protracted
已。
deafness, tinnitus accompanied by lassitude in the
并
lumbus
见
and
腰
knees,
膝酸软、
vertigo and
头
blurred
晕目
vision,
眩、
a red tongue with a
舌
little
骨少
coating,
开、
and a
脉
thready
稀疏
and rapid pulse. Treatment:
治疗
body acupuncture,
取耳部穴
locate
位
E
一
feng
峰，
sanjiao
直刺
17
分至
and
骨
puncture 0.5 to 1 cun perpendicularly. And from Arman Sanjiao 21 to
向下斜
Qinggong
刺
small
1
intestine
至
19,
1.5寸，
puncture 1 to 1.5 cun obliquely downward with the even movement method to
用
promote the
平骨
circulation
直
of
线
the meridian
疏通
and
经
for
络，
resuscitation.
理气开窍。
Waiguan Sanjiao 5 and Fangshi gallbladder 20 are supplemented for treating exogenous pathogenic wind heat.
用泻法疏
The
风清
reducing
热，
technique is used to disperse wind and clear heat.
肝胆火盛
Taichung
加
liver
肝清
3
原血
and
太
Qiushu
冲，
gallbladder
胆清
40
原血
are
休
supplemented
虚，
for treating liver fire and the gallbladder. The reducing
泻法
technique is used
清
to
泻
clear the
肝
fire
胆
in the
火血。
liver and the gallbladder. Shenshu bladder 23,
肾虚加肾
Guanyin
腧、
Ren 4,
关元、
and
气
Qihai Ren 6 with moxibustion are commonly supplemented
多
with
用
kidney
灸法
deficiencies or with the reinforcing technique of acupuncture to
针
nourish
刺
the
则
kidney
用
for
灸法
restoring the
补
hearing
肾
function.
充耳。磁片贴
Magnetotherapy
穴
of points. Two magnetic pieces
用两
with
片800
800
至
to
1500
1500
高斯
gauzes are
片
used,
分
with their
阴极和
cathodes and
阳极
anodes applied
分
on
别贴于
Qinggong
宫
small
和
intestine
一峰穴
19 and Yifeng Sanjiao 17 respectively. Connect the other ends with the
然后
electric
连接电
acupuncture
子机
instrument. Apply continuous electric current. treat 15 to 20 minutes
用
each
连续
time.
播，
This is effective for tinnitus.
每次加电15至20分钟，对耳鸣有效。
Hydroacupuncture therapy. With 6542 injection, inject into Tiangong, small intestine 19, and Yifeng, Sanjiao 17, 0.5 to 1 milliliter for each point.
每天或隔天一次。
Treat once every day or once every other day. Rhinorrhea with turbid discharge.
鼻渊
Fetid,
是指
thick,
病
and
人
sticky
鼻流
nasal
清爽
discharges
气，
are accompanied by nasal obstruction,
泛鼻塞
hyposmia,
是嗅觉减
or
退
loss
或
of
者
the
丧
sense of
失的
smell.
一种病症。
It is similar to sinusitis.
相当于鼻窦炎。
Pathogenic factors. The nose is the
肺
door to
开
the
窍于
lung,
鼻，
and the rhinorrhea is related to the attack of pathogenic factors to the lung meridian. In the early stages, it is accompanied by headache,
胃疼、
chills, fever,
发热、
and a superficial and
脉浮
rapid
数等
pulse.
外感症状。
If it is a chronic case, there may be distending pain
日
in
久
the
常
forehead
见
and
微
eyebrows,
额胀痛、
vertigo,
眩晕、
and nasal
鼻塞
obstruction.
等症。 治
Treatment.
疗。体
Body
针
acupuncture.
选取迎
Locate
香
yin
穴，
xiang, large intestine
向内
20.
平次5
Puncture
分，
0.5 twin horizontally. Locate yin
取印堂
extra
穴
point
及
and
团子穴，
huanzhu ladder 2. Puncture 0.5 twin obliquely
向下
downward to
斜
promote
刺
the circulation of the
可以
meridian
通经
and
印堂。
benefit the nose. Select
取
hebu,
合谷
large intestine 4. Puncture
决刺
0.5 twin perpendicularly with the reducing technique to disperse heat and exogenous pathogenic factors. B-tone
经脉
extra
提穴
point
鼻
at the
孔
highest
位
part
于
of the
鼻头
nasolabial
上方筋
groove
处，
is punctured 0.3 to 0.5 twin
向内上方
subcutaneously
平次
with the
3
needle tip
正
pointing
分，
inward
表
and
通鼻
upward to
窍
restore the function of the nose. In case of
借由
invasion
外
of
感症状
exogenous
者加
pathogenic
风池、
factors,
曲
Fengchi, gallbladder 20,
等。
and Chu-Chi, large intestine 11 are supplemented
每天
to
治疗
disperse
一次，
wind and heat.
留针
The
20
treatment is given
至
once a
30
day.
分钟。
Retain the needles for 20 to 30 minutes. Hydroacupuncture
穴位注
therapy.
射
Use injection calciferally at calci
用维丁
colloidals,
胶性
1
钙1 毫
milliliter,
升，加
and
维生
vitamin
素
B12
B12
100 mcg. Inject into yin xiang, large
注射
intestine
迎香
20,
穴
or
或
B-tone
鼻通
extra
穴
point, 0.5
每穴
milliliters
0.5
each
毫升
side.
每
Inject
天
once
或
every
隔
day
天一次。
or once every other day.
牙痛、
Toothache. The causes of toothache are numerous. Dental
牙
or
痛的原因
periodontal
是
diseases may result
牙
in
齿
toothache.
或牙周疾病皆可发生牙痛。
Pathogenic factors and differentiation of symptoms and signs. First,
由阳明
toothache
火
may
邪
result from
循经
abnormal
上
fire
面气，
rising along the Yangming meridian as the stomach meridian goes into the upper
因为
gums
足阳
and the
明
large
经
intestine
入上
meridian
齿中，
goes to the lower gums.
手阳明经入下齿中。这类牙痛
The
常
accompanying
见有
symptoms
口
are
渴、口臭、
thirst and foul breath,
便秘、
constipation, a red tongue with a yellow coating,
脉红
and a
数。
strong and rapid pulse. Secondly, it may be caused by the deficiency of the kidney yin with flaring up of fire manifested as vague pain off and on,
表现为隐隐作痛，日清夜
better at daytime but worse at night,
牙齿红
loose
肿，
teeth,
舌
a
红
red
少
tongue with a
苔，
little coating,
脉
and
细
a
数
thready and rapid pulse. Third, toothache resulting from the invasion of exogenous pathogenic fire and wind, which is manifested by fever,
多有发热、胃疼、
chills,
牙龈肿
inflammation
胀、
of the gums, a pink tongue with a thin and white coating,
脉浮
and a
损、
superficial and rapid pulse. Treatment:
治疗、
body acupuncture.
取手阳明大肠经的原
the
穴
source point
合
of the
谷
large
为主，
intestine meridian, is
用以
used as
疏
the main
通阳
point
明
to
经
promote
气
qi circulation of the yang-ming
均
meridians for any type of toothache. 下关三角7 is supplemented for upper
这次
toothache.
分治
Puncture
不遂，
0.5 to 1
用线
perpendicularly with the reducing technique.
下牙痛
Puncture
给
jaw
牙
to
出
stomach
血，
6 for lower
0.5
toothache.
至
Puncture
1寸，
0.5 to 1
用线
swing subcutaneously with the reducing technique to expel fire of the yang-ming meridians. For toothache caused by fire deficiency, select IC kidney 3. Puncture 0.3 to 0.5 swing perpendicularly with the reinforcing technique to nourish yin and extinguish fire. The secondary points for toothache caused by wind fire are puncture, gallbladder 20, and
以
right
疏
one.
风清热。
Puncture with the reducing technique to disperse wind and heat.
耳根
Auricular acupuncture.
取穴
Puncture
神门，
are 神门,
平接
tratic apex,
枕
occiput,
和
jaw,
牙
and tooth with strong stimulation.
强刺激，
Retain
留针
needles for
1
1 to
至
2
2小
hours.
时，针
Apply
好
seeds
埋压
after
耳中，
puncturing.
反复按
Press the seeds repeatedly. ，sore throat.
咽喉肿痛，
Sore throat may be complicated by tonsillitis,
咽炎、
pharyngitis, or laryngitis.
扁桃体
Tonsillitis
炎
in TCM is called lure, while pharyngitis and laryngitis are of Hoby. Pathogenic factors can manifest as symptoms and signs. There are two types. The type of excess heat is caused by the invasion of exogenous wind heat or the accumulation of heat in the lung and stomach.
或肺胃
The
积热引起，
manifestations are severe
发
dry
病急
throat
骤
and thirst,
咽干口渴、
cough,
咳嗽、头痛
headache
发
with
热、
fever,
舌红
a
苔
red
黄、
tongue with a yellow coating,
脉浮数。
and a floating and rapid pulse. The type of fire deficiency is caused by yin
因素体
deficiency
阴虚
and the，flaring
虚
up of
火上
fire.
炎引起，
The
发病慢，
manifestations are
头
gradual.
痛轻，
Mild pain, discomfort in swallowing,
吞咽时有不适感，
a red tongue with
舌
a
骨
little
上苔
coating,
脉
and
细
a thready and rapid pulse. Treatment:
治疗，
body acupuncture. For excess heat,
绝热型
Hagu, large
取
intestine
手阳
4,
明经
the
原
source
穴
point of the
合
hand
这
yang
次
meridian
分
is
治不
located.
遂，
Puncture 0.5 to 1 swin perpendicularly.
再
Locate
取
Shaoshang
少商
lung
或商
11
阳，
and Shangyang large intestine 1 and puncture them to deplete and disperse heat and
点
relieve the
刺出
pain.
血，以泻热止痛。虚
For
火
fire
型
caused
取
by
太溪
deficiency,
或
locate
照海，
Tai-Si kidney 3 or Jiaohai kidney 6 and puncture 0.5 to 1 swin perpendicularly with the reinforcing or the even movement technique to nourish yin and extinguish
滋
fire.
阴降火。
For strengthening the throat,
有利咽喉
Tianzhu
作用，
letter 10 can be
不呼吸时
punctured for
胸口
excess or deficiency syndromes.
耳根
Auricular acupuncture. Locate points
取咽
throat,
喉、肺、
lung,
扁桃体、
tonsil,
轮一、
and helix 1,
轮三、
3, and 5.
中强刺激，
Moderate to medium stimulation is applied. Retain the needles for 1
留
to
针
2
1至2
hours.
小时后，再用耳珠埋压。
Seeds will be embedded later.
刺络法
Depletion method. For excess heat, deplete
实刃
argan extra
常用耳
point
尖
or
或
use
耳
the
背硬
posterior
旁
ear to
有
purge
泄
heat
热
and
止
relieve
痛效
pain.
果。肥胖症，
Obesity.
肥胖是指除肌
Obesity
肉
does
发
not
达、
refer to
蛋白质
muscular
增多
atrophy,
或水
nor
钠
an
储
increase of leanness in tissues, nor fluid retention. When
因进
caloric
食的热
intake
量
exceeds
多于消
caloric
耗的热
consumption,
量，
the
多
extra
余热量
calories turn
以
to
脂
fat
肪形式
and
储存体
accumulate
内，
in the body,
使体重
resulting
超
in
过正常
overweightness
标准
20% more
20%。
than the normal index.
衡量肥胖有2种计算
There
方
are two
法：
methods to measure obesity.
一，
One,
实际体
when the
重
actual
比标
weight
准
is
体重
20% more
大
than
于
the standard weight.
20%；
And two, when the body
体
weight
重指
index
数
is over
大于
24.
24。
Pathogenic
病因
factors. Obesity
本
is
病
caused
与
by
进食过
overeating,
多、运动不
a
足、
sedentary lifestyle,
家族遗传、
inherited slow metabolism,
内分泌
and
失调有
endocrine
关。
disorders. There are two types of obesity.
辩证
Differentiation of symptoms and signs. The qi
气
deficiency
虚
type.
血，除肥胖外，兼神
Obesity is
疲乏
accompanied
力、
by general lassitude,
心悸
palpitation
气
and
短、
breathlessness,
自汗出、
spontaneous perspiration,
舌
a
淡开
pale
白
tongue、with a white coating,
脉沉
and a
细、
deep and thready pulse. The phlegm
寒
and
湿血
dampness type. Its manifestations are
表现为
dyspnea
胸
with
闷
a
气
feeling of
喘、
heaviness in the chest,
喉中有
phlegm in the throat,
疲倦无力、
lassitude, a pale
舌淡
tongue with a
开白
thick
后
and white coating,
脉
and a
滑、
rolling pulse. Treatment.
治疗、
Body acupuncture. For qi deficiency, use 脾腧
气虚
letter
血
20,
从
胃腧
脾腧、
letter
胃
21,
腧、
Zhongwan ren
梁
12, Liangmen stomach 21,
足三里、
Zusanli stomach 36,
合谷、
Hegu large intestine 4,
缺池、
Chuchi large intestine 11,
气海中，
and Qihai ren 6.
每次交替选
Select
取
2 to 4
2
of
至
the
4
points
时，
above and puncture
用
alternately
古法
with the reinforcing
也可艾
technique
灸
or with
或
moxibustion by
针灸
moxicones
有
to
健
warm
脾
the
补气作
needles.
用，每天1次。
Treatment is given once a day to nourish spleen and strengthen the qi. For the accumulation of phlegm and dampness, needle Zusanli
寒湿
stomach
血
36,
从足三里、
Fanglong stomach 40,
三阴交、
Sanyinjiao spleen 6,
阴陵泉、
Yinlingquan spleen
内
9,
关、
Meiguan pericardium
尺泽、
6, Chizhe lung
太
5,
渊中，
and Taiyuan lung 9.
每次交替选
Select
取
2 to 4
2
of
至
these
4
points and puncture
有
alternately
平
with the
补
even
脾
movement
血法，
technique
能
to
健
invigorate
脾
the
祛
spleen
湿
and
化
remove phlegm and
痰，每
dampness.
天1次。
Treatment is given once a day. Auricular acupuncture. Locate points
起肾、
kidney,
脾、
spleen,
口、
mouth,
胃、
stomach,
肺、
lung,
内分泌、
endocrine,
咽喉，
and throat.
用耳珠埋压
Seeds
法。
are administered. Apply 30 minutes
在
before
每次
meals
进餐
or
前
when
30 分
feeling
钟。
hungry. Press the seeds for 1 to 2 minutes to
或有
reduce the
饥饿感
feelings
时
of hunger，and
按压耳
appetite.
珠1至2分钟。 可以减轻饥饿感和食欲。
Diet control.
控制饮食有助减肥。
Diet control is beneficial in losing weight.
成人
The
每
quantity
天
of
进食热
calories
量
from food
应控制
intake for
在
adults
1200
should not exceed 1,200 calories daily. When feeling hungry, the intake of vegetables or fruit should be increased.
坚持
Constant
适量
and
运动
moderate physical
和减轻
activities will help reduce body
如
weight.
参加登山、
Hiking,
游泳、
swimming,
打球、
playing table tennis,
做健美操
and aerobic exercise are all beneficial. Stop
戒
smoking.
烟。吸烟危害健康，可引起多种疾
It
病。
may cause various diseases. Smoking is
不但于
harmful
己
not
有
only
害
to the health of
也
the
危害他
smoker,
人健
but
康，
also to that of
因
the
此
others.
提倡戒烟。
So, we advise smokers to give up smoking.
治疗
Treatment.
耳根、
Auricular acupuncture.
取
Rookie
神门、
points are shenmen,
口、
mouth,
肺、
lung,
内分泌、
endocrine,
气管、
trachea,
垂前、
and trachea. Seeds are administered at these points.
当出现烟瘾时，按压耳珠，
When feeling
每
the
次
urge to
1至2
smoke,
分钟。
press the ear points. Press 1 to 2 minutes each time.
吸烟者治疗后，
After
自觉
treatment,
口苦
the，smoker will feel a bitter taste in the mouth,
吸烟
tastelessness
乏
and
味，
disinterest
兴
in
趣下降，
smoking, and finally will reduce the frequency of smoking or even
减
stop
少吸
smoking.
烟，甚至戒烟。体针
Body acupuncture.
因戒烟而觉口淡乏味，
Symptoms are tastelessness,
胃纳
a poor
欠佳、
appetite,
恶心流涎、
nausea and salivation,
肌肉无力、
myasthenia,
精神
and a
不集
lack
中
of
等
concentration.
或戒断综合症。
This is called post-smoking syndrome. Select
可取合
Hedu, large intestine 4,
列缺、
列缺 lung
足三
7,
里、
Zusanli, stomach
三阴
36,
交、
and Sanyinjiao, spleen 6. Needle
用
with
泻法
reducing
治疗。
technique.
"戒毒
Stop drug addiction.
吸毒
Drug
严重
abuse
危害
is
健
very
康，
harmful to the
但吸
health.
毒后有一种
After
心
taking
态感，
drugs, however,
上瘾
one
则
will
难
feel
以戒
elevated,
断。
so it is difficult for the drug addict to stop completely. If forced to
想停戒
stop,
断后
the patient may
病
feel
人精神萎
listlessness,
靡，全身
general
无力，
tiredness,
口流涎
salivation,
沫，不思
poor
饮食，
appetite,
汗出流泪，
perspiration and lacrimation,
坐卧不安，不可
restlessness,
自主。
and will be upset.
痛苦不可
The
言状，
patient suffers
甚
much,
至有生
feeling
不
that
如死
staying
的感觉。
alive is no better than being dead.
针灸能安
Acupuncture
神，
can tranquilize,
宽胸
regulate chest disorders and qi,
化
and
痰
relieve phlegm
解
and
郁
depression, so the
可减
symptoms
轻
mentioned
或
above
消
can
除
be
上
alleviated or eliminated.
治疗
Treatment.
耳根
Auricular acupuncture. Locate points are
身门
shanmen,
肾
kidney,
口
mouth,
外鼻
external nose,
脾
spleen,
肺
lung,
肾上腺
adrenal,
皮质下
subcortex,
内分泌
and endocrine.
先
First
用
of
毫
all,
针强
use
刺
filiform needles to puncture with strong
并
stimulation.
留针1至2小时。
Retain the needles for 1 to 2 hours. When the patient
病
feels
人自
discomfort
觉
or
不适时，
restlessness,
再捻
twist,
转提
lift,
它。
and thrust the needles.
病人安静后，改用耳钩麻药。
When the patient is calmed down, use seeds. Body acupuncture. Needle 水沟 do 26,
水沟
承浆
承浆
24, 合谷 large intestine 4, 内关 pericardium 6,
尺泽
尺泽 lung 5,
足三里
足三里 stomach 36,
丰
and
隆
Fenglong stomach 40 with the reducing
用泻法
technique.
每次
Retain
留
the
针
needles for
20
20 to
至
30
30
minutes
分
each
钟，
time.
每天1
Treatment
至
is
2
given
次。
once or twice daily. Facial beautification. The quest for beauty is a
爱
human
美乃
instinct.
人之天性。
Acupuncture for facial beautification is
针灸
based
美
on the theory
是
that the
根据
facial
人体
muscles
面
and
部肌
skin
肤
are
与
closely
人体
related
脏
to the
腑、
zangfu
经络、
organs,
气血
meridians,
密切相
and
关的
qi
理论。
and blood of the human body. Acupuncture can
通
regulate
过
the
针
function
灸
of the
调理
zangfu
脏
and the
腑经络、
meridians
气
and
血
of qi
功
and
能，
blood
促
to
使
promote
面部
facial
血液
blood
循环，
circulation,
改
to
善和
improve and
调节
regulate
面部
facial
细胞
cells
及
and
皮质代
sebaceous
谢，
metabolism,
增加皮
and
肤
to
肌肉
increase the
弹性，达
elasticity
到
of the
美
skin
容效
and
果。
muscles. Corresponding meridian point selection. According to how the meridian distribution is arranged, the treatment of the face is divided into 9 sections.
各做水平
First,
线，
draw 2 horizontal lines
经
on the
双侧
levels
鼻
of
翼
the eyebrow
及
and the
部
lower
外的
margin of the
各
nose.
做一垂直
Then
线，
4 vertical lines
把
are
面部
drawn
画
along
为9
bilateral
区，
wings of the nose
各
and the outer
区循经
campus.
取穴。
The points are located along the due meridian and the bladder meridian.
鼻上
Nasal
区属
superior
督脉
region.
膀胱经，
Adjacent point selection. 印堂
进部
extra
取
point.
印堂、上心、
Shanxing, do 23,
传主穴
and Chuanzhu, bladder 2 are selected. Distant
部
points
取
selected
昆仑
are Kunlun, bladder
中穴
60, and Weizhong, bladder 40. The superior section of the eye pertains to the
目
stomach
上穴
and
属
gallbladder
胃经、
meridians.
胆经。
Adjacent point
进
selection.
部取
Yang
阳白
Bai,
穴，
gallbladder 14. Distant points,
远部取
Yang Ming Quan,
阳陵泉
gallbladder 34,
内庭、
Niting, stomach
足临
44,
气穴。
and Zuling Qi, gallbladder 41 are located.
额角区
The
属
area
胃
of the
经，
frontal angle belongs to the stomach and gallbladder meridians. Adjacent point selection.
进部取
Towei,
胃穴，
stomach 8. Distant point
远部
selection.
取阳陵泉。
Yangming Quan, gallbladder 34, and Neiting, stomach 44 are located. The nasal region
Qi
belongs to the dual
督脉
meridian, the large intestine
大肠经
meridian, and the stomach
胃
meridian.
经。
Adjacent
进
point
部取印
selection.
堂、
Locate Yintang
素疗
extra point, Su Liao
Yingxiang 穴
25, and Yinxiang large intestine 20.
远部取
Distant
合
point selection. Hegu large intestine 4, Niting stomach 44, and 裂缺
填表里
lung
经
7.
取列缺穴。
The
前区
zygomatic
属
region
小肠
belongs to
经、
the heart,
心
small
经、
intestine, and stomach
胃经
meridians.
进
Adjacent points located are 全寮 small intestine 18 and 四白 stomach 2. Distant points located are 养老 small intestine 6, 少腹 heart 8, and 内庭 stomach 44. The preauricular region involves the stomach and 三角 meridians.
三焦节。
Adjacent points located are 下关 stomach 7 and 耳门三角 21. Distant points located are 外关三角 5, 支沟三角 6, and 足三里 stomach 36. The section around the mouth includes points of the ren, ju, stomach, and large intestine meridians.
大肠经。
Adjacent points located are 地仓 stomach 4, 水沟 do 26,
承浆穴。
and 承浆 ren 24. Distant points located are 合谷 large intestine 4,
足三里。
足三里 stomach 36,
列缺穴。
and 列缺 lung 7. The facial buccal area involves the stomach meridian. Adjacent points located are 甲车 stomach 6,
大营穴。
and 大营 stomach 5. Distant points located are 内庭 stomach 44,
足三里穴。
and 足三里 stomach 36. The anterior and inferior ear region pertains to the stomach and 三角 meridians. Adjacent points located are 一风 三角 17 and 甲车 stomach 6.
远部
Distant
支
points
沟。
located are 支沟三角 6,
内关。
内关 pericardium 6, and 足三里 stomach 36. It is also recommended
还可以
to
根据
locate
拼片
points
性质
based on
辨证。
differentiations of symptoms and signs. In the case of hypersteatosis, the therapeutic principle should be of clearing away damp heat of the
心
spleen
脾
and
胃湿
stomach.
热。
Puncture 足三里 stomach
内
36,
庭。
内庭 stomach 44, 上心
阴陵泉
23,
用
and
线法。
阴陵泉 spleen 9 with the reducing technique. For facial acne caused by wind heat in the lung meridian, the therapeutic principle should focus on the expelling of wind and heat. Puncture 曲池 large intestine 11, 合谷 large intestine 4, and 列缺 lung 7 with the reducing technique. For facial acne caused by damp heat in the spleen and stomach, the therapeutic principle should be of clearing away damp heat. Puncture 阴陵泉 spleen 9 and 内庭 stomach 44 with the reducing technique. For facial acne caused by an imbalance of the Chong and Ren meridians, puncture 三阴交 spleen 6
指三阴交。
and 关元 spleen 4
用
with the
平
even
平
movement
线。
technique. For facial wrinkles or facial flexicity,
皱纹增多，
treatments should
面积
aim at
松弛。
reinforcing the spleen,
质疑健
nourishing
脾胃
blood,
养气
and
血，
relieving the
疏
depressed
肝
liver
解
qi.
郁。
Puncture 足三里 stomach
指足三里。
36,
三阴
三
交。
阴交 spleen 6,
太冲。
太冲 liver
太溪
3,
穴。
and 太溪
用无法
kidney
为主。
3, primarily with the reinforcing technique. For lower
垂眼袋。
eyelid swelling and paralysis,
质疑
treatments
补
should
气
aim
生
at
脾。
invigorating and elevating the qi. Treat
指
by
百
Hui,
会
do 20,
足三里
and
穴
Zu Sanli,
用
stomach
灸法。
36 with moxibustion. And puncture
针刺
Shen Mai, bladder 62,
足临气。
and Zu Ling Qi,
留针
gallbladder
20分钟。
41. Retain the needles for 20 minutes.
黑板
For
黄色
melasma
斑。
or chlasma, treatment should aim at relieving the depressed liver qi, of nourishing the liver and kidney, of promoting blood circulation and removing blood stasis. Locate 太冲 liver 3, 照海 kidney 6, 曲泉 liver 8, 肝疏 bladder 18, and 肾疏 bladder 23. Treat with the reinforcing or reducing technique respectively. For facial acupuncture, use 0.3 to 1.0 twin filiform needles primarily, to puncture subcutaneously, horizontally, or obliquely. For facial moxibustion, pay attention to the control of the heat intensity. Avoid burning the skin. Better results can be achieved in beautification treatments by combining acupuncture with facial massage.